Hello. Last video I talked a little bit about atherosclerotic heart disease in the arteries that supply the muscle of the heart. Today I'd like to talk a little bit about the other kind of common heart disease, which is valvular heart disease. So let's go over a little bit of basic anatomy. There are two chambers on each side of the heart, an upper collecting chamber called the atrium and a lower main pumping chamber called the ventricle. There are also two sides of the heart, right and the left. The right takes the blood that comes back from the body and pumps it to the lungs. The left side collects the blood from the lungs once it's got its oxygen and then pumps it out to the whole rest of the body. So what are the valves in the heart? Well, there are four. On the right side, between the right atrium where the blood comes back from the body and the right ventricle is the tricuspid valve. Then between the tricuspid valve and the main artery going to the lungs, the pulmonary artery, is the pulmonary valve. Fortunately, those aren't very often affected by heart disease that needs to be addressed primarily. The left side of the heart has two major valves. One between the upper chamber, the atrium, and the ventricle. That's called the mitral valve. It got its name because it looks like a bishop's hat. It's kind of like this. It is a very dynamic valve. It is suspended off the wall of the heart, and we'll go over the diseases of the mitral valve in a minute. The most common one that's affected is the aortic valve. The aortic valve is between the main pump, the left ventricle, and the aorta, the big artery that sends off branches to all your body except for the lungs. When we're born, the classic aortic valve is made up of three little leaflets that are very pliable, a lot like inner tube. They open all the way up, they close all the way down. The most common problem that we get is aortic stenosis, or narrowing of the valve. What happens in that typically is that some calcium and thickening of the valve occurs, so it becomes more like the tread of a tire. It doesn't open all the way up, and quite often it doesn't close all the way down. The most common congenital heart defect, birth defect of the heart, is what we call bicuspid aortic valve. Instead of three little leaflets that open up, they're just two leaflets that open up. And that has a tendency to get thickened and lay calcium down at an early age. So for folks who have bicuspid valve disease, that will present classically in the 40s to early 50s. The aortic stenosis, the thickening and the narrowing of the valve, will typically occur later in the 60s, 70s, and 80s. Sometimes what can happen is that valve can become floppy, and rather than meeting and closing, it will just go back, and that's called regurgitation, backwards flow. And that needs to be addressed basically the same way as the other disease of the aortic valve, but it has different effects. The mitral valve, the most common problem that we have now is what we call mitral regurgitation, which is where the leaflets either don't completely meet because they're restricted, they can't move, or they've gotten very floppy so that they go and they open up coming backwards. Or sometimes as people's hearts dilate out, this valve is mounted on a ring on the muscle wall, and as it dilates out, those leaflets don't grow, and then suddenly there's an area where it can cause regurgitation. In a later video, I'll go over the symptoms and how we address these problems with the valves. Hopefully this gives you a better understanding of basic valvular anatomy and the really basic concepts of valvular disease. Please go ahead and look in my description below for a link to the atherosclerotic talk, and also please like and subscribe. Have a great day.